Okay, so MLTs and MMTs for the hip. Go over MLTs first. So I won't go over too much as far as what you would do for the actual procedure, but I'll do it for the first one, but the rest of them I'm just going to show you the technique. So first of all, you want to do both sides, and then you essentially kind of tell them to relax and instruct them that you're going to take them through a stretch. And as you do it, you ask them if they feel a stretch. If they do, then you ask them where. And then you kind of watch for their face for grimace or watch for substitutions, things like that. So that's kind of the idea behind it. If I can have you actually come on up here, we're going to do the Thomas test first. All right, so let's say I'm going to test his left hip. What I'm going to have him do is bring his right leg up, have him hold his knee there, sit him nice and tall, and then what I'm going to have you do is I'm going to have you have a seat on the table, and then holding your leg, I'm just going to have you lie back. Okay? Okay. Okay, and then I'm going to bring this right about 90 degrees of flexion, and then I'm going to hold his leg, and then go and relax for me. Find his ASIS. I'm going to kind of stabilize that right there, and then I'm going to take him slowly down into extension until either I feel like his pelvis is coming up into my hand or to the point where he no longer lowers his leg. You want to see if the back of the leg can touch the table. So I can see right now the pelvis is coming up into my hand and his leg is not touching the table. Kind of looking at his knee angle, looks kind of like it's at 80 degrees, but I do notice that it's definitely not touching, so I kind of want to rule out if it's an iliopsoas or rectus femoris. So I'm going to start over again. I'm going to have him straighten his leg. Same thing, make sure you stabilize at the ASIS. And then you lower his leg to see if now he can touch the back of the table. Looks a lot better, so what I would probably suspect off the top of my head, since he's pretty close to touching the table, and he's not exactly popping in my hand quite yet, I put the rectus femoris on slack, therefore I would probably say that he has more of an iliopsoas tightness. That sound about right? Good with that. So that's kind of how you do it. And you also kind of want to see if they have any internal and external rotation of the hip. That'll tell you if the Sartorius or the TFL are involved as well. Okay, go ahead and scoot back on the table. All right, next we're going to do the straight leg raise. Embroider your sweatshirt. Okay, I'm going to test this side, so the other side I want to stabilize with the towel. Right there, if I can. Okay, I think that should work. Okay, you kind of stabilize this with my knee, and then you're going to watch his back to make sure that it's not flattening or overarching in any way. And keep his legs straight and try to bring him up as much as I can until either there's some give or he starts to feel a stretch. Feel a stretch right there? Where at? Hamstring, okay. So as you can't really tell from the camera angle, but not quite at 80 degrees, so he's probably got some good hamstring tightness. Now, if he had felt a stretch, but he said it was kind of more in the calf or it was more like a, I don't know, tingling or burning feeling, then we would do a modified version. Modified version would be you put the patient at 80 degrees of hip flexion, and then from here, while he's in 80 degrees of hip flexion, you straighten the leg and see if he can, oh boy. You know, still not quite there. So that's for hamstring tightness. Last test here is for over, or it's called over for the TFL. So go ahead and one on that side, yes. All right, so he's gonna bend his knee and his hip, the bottom one. And then this leg, we're gonna do the full version first where the knee is bent. And then we put him in slight flexion, AV.10, and then extend him. Watching for any compensations in the spine. So about right there is where I want to stop. I keep his leg above horizontal, that way I can lower it and get an accurate reading. I'm going to stabilize right on the iliac crest. And then what I'm going to do with this leg that's holding the thigh, I'm going to slowly lower it down until I feel kind of the iliac crest pop into my hand. So right now, it's kind of starting to a little bit, and I see that his thigh is about 10-15 degrees above horizontal, so this would indicate some TFL tightness. Now, if he had, now a normal finding would be, I think, right at horizontal, right? So if you can get to horizontal, that's a normal one. Now, if you had any knee pain, I would do the modified version where we would straighten the leg, same thing, same setup, same stabilization, and you're lowering the leg. But this time, he should get down a little lower. So if he's able to get past horizontal, that's a normal reading. But if not, if he can't go any lower than horizontal, then probably still pretty tight.
It's 10 degrees.
It's what?
10 degrees.
10 degrees? Yeah. So those are the MLTs. And now the MMTs. What do we got next? Okay, we're going to start with the hamstrings. So maybe lie on your stomach. Okay, so you can test the medial and the lateral hamstrings. And so what I want to do is, first of all, with any MMT, first you show them the movement passively, and then you show them actively, and then you kind of instruct them to hold position and don't let them move you. And make sure that you tell them to breathe and watch for any facial grimace or any kind of abnormal response. So in other words, pay attention to the patient. So your medial hamstrings, you're going to, right, this is medial hamstring, yeah.
It's the only one exposed.
Correct. The only one exposed. So so I'm just going to show the patient what you're going to do. Okay, Angel, so here's what you're going to do. You're going to flex your knee. You're going to bring it down. Can you do that? Okay, good. All right, so now what I want you to do is I want you to hold it right about here. And I want you to keep it here and try to breathe. Don't let me move you, okay? All right, so that's a pretty solid 4 plus. And you feel okay?
Mm-hmm.
Okay. That was medial. Lateral is just the opposite. So.
That's medial.
Okay, so we just tested lateral then. Never mind, we just tested lateral. So now we're going to test medial. Same exact thing. Show them the movement. Can you do it? Okay, good. All right, so now I want you to hold it here and don't let me move you. Yeah. You okay?
Mm-hmm.
Oh, tell them to breathe. Okay, hip flexors. Go and sit on the edge of the table, please. Okay, there's 2 versions of it. One is the grouped and one is the iliopsoas. They're both the same exact thing, except the iliopsoas, you're going to have them flex their knee or flex their hip up higher. So I'm going to test this one. So I'm going to stabilize the opposite shoulder. All right, Angel. Here's what I want you to do. I just want you to. I'm going to test the iliopsoas. So I'm going to bring it up here. Can you do that? Can you do that for me? Okay, good. I want you to bring it up again. Okay, I want you to hold it there and don't let me move you. Okay? Okay, next is TFL. So you're going to lie on your side. So you might actually face the other way. This one.
Oh, wait.
Yeah. Okay. So for anything on sideline here, I'm just going to make sure that he's not like moving his pelvis too much, but I want to try to keep it stable. So you can bend this one, and then this one, I just want you to okay, so I want you to kind of bring it up like that. Can you do that? All right, good. I want you to hold it there. Hold that position, try to breathe, don't let me move you. You all right?
Mm-hmm.
Next is the internal and external rotator. So once again, I'm going to have you sit on the edge of the table. Okay, so internal rotators. Now here's what I want you to do. I want you to bring your leg in and back down. Can you do that? Okay, good. Now I want you to hold it there. Try to breathe, don't let me move you. All right. Same thing, external rotators. Here's what you're going to do. Can you do that? Hold it there, and don't let me move you. Okay. Okay. Glute med and glute min. Once again on your side. There we go. Okay, glute min is pretty simple. All you're going to do is bring your leg straight up and back down. Can you do that? Okay, good. I want you to hold it up there. Try to breathe, don't let me move you. Okay. And then glute med, what you're going to do is you're going to have them slightly externally rotated. So what you're going to do is kind of bring your leg back like that. Can you do that? Okay. I want you to hold it there. Hold that top position. Try to breathe, don't let me move you. Then Sartorius. I believe you're going to bend your back for this one. So Sartorius, you're basically going to have them going like they're crossing their leg. And then straighten it down. Can you do that position for me? Okay, good. All right, so this one's a little complicated, but essentially what you're going to do is you get them into that cross knee position. You're going to push them into hip extension, internal rotation, and then straighten their leg kind of like that. That's essentially what you're doing. So they're trying to resist that. Okay, so I want you to hold this position and don't let me bring you out of it. Ready? And try to breathe. Oh God. This dude's got a strong Sartorius. All right, adductors. Adductors, you're gonna be on your side again. This one kind of looks a little weird setup wise, but essentially what you're gonna do is you're gonna support this top leg, and then the bottom leg is actually what you're gonna be testing. So you're just gonna bring your leg up and back down. Can you do that? Very good. Okay, I want you to try to hold that right there. Try bring the leg up and don't let me move you. And I believe it's okay if they use some sort of counter pressure, just make sure that they're not rotating and compensating too much. And if they do, just make note of that. And lastly, on your stomach, glute max. Okay, so this one, the knee's gonna be bent, and what you're gonna do is you're just gonna bring your hip up and back down. Can you try to do that? Okay, good. Okay, I want you to try to hold that position, and don't let me move you. Push, push. There you go. There you go. MLTs and MMTs.